I'm here with Speaker Mike Turzai, a Republican from Allegheny County. Speaker Turzai, can you tell us a little bit about the situation with COVID-19 in your district right now?
Yes, Cass, Allegheny County, let me get you the statistics there. Where do we have those, Stephen, the Allegheny County statistics? Because they're so sad. Really, Allegheny County is not as hard hit as many of the other counties are. Allegheny County has 1,218,000 people. And I'm in the north suburbs of Allegheny County. And our deaths, unfortunately, to date, here they are. We have 139 of our fellow citizens have passed away in Allegheny County. Now, 109 of those deaths occurred in either a nursing home, a personal care home, or an assisted living residence, which are all, statutorily defined under law. That means of those that have passed away in my home county, nearly 80% of those that have passed away in those senior settings.
Now, you introduced a piece of legislation recently that would help protect citizens who are living in those types of places. Can you talk to us a little bit about what that legislation is and what it will do to protect the older adults of Pennsylvania?
Yes, thank you so much. Unfortunately and sadly, 3,943 of our fellow citizens have passed away attributable to COVID-19 in the Commonwealth of Pennsylvania. Of those, 2,705 have passed away were in these nursing homes, personal care homes, or assisted living residents. In those facilities, it's clear, and we only began to receive those statistics after I wrote some letters to the Secretary of Health. We specifically asked for what was happening in these particular settings. And towards the latter part of April, we started getting the statistics, and it's clear that those are the most vulnerable population. In addition, having comorbidities or what you would call underlying medical issues. So we've worked with the academic medical centers, in particular, of which Pennsylvania is blessed to have, by the way. I'm from out west. I'm the Pittsburgh suburb, so I'm most familiar, obviously, with UPMC health system, which is the largest employer in the Commonwealth of Pennsylvania, and they have 40 hospitals across the state and 5,522 beds. Consistently over the last weeks, they've only had 2% of their beds filled by persons with COVID-19. In addition, they don't have many patients who are using ventilators. In the state, the percentage in all of our hospital beds, which is about 37,000 hospital beds in the Commonwealth of Pennsylvania, about a little less than 7% have COVID-19 patients, and in fact, that has gone down. There are 2,129 hospitalizations as of today, so actually that percentage has gone down to really around 6% or less, and about 461 of those patients have ventilators, which is almost just above 1% of all the hospital beds. So the issue is how do we get to the folks that are most vulnerable? And we introduced a bill that we developed with UPMC. And we talked to Dr. Gladwin, who's the head of medicine at the University of Pittsburgh and for UPMC hospitals. We talked to Deborah Brodine, who's the CEO of West Penn Psychiatric Hospital for UPMC, and she also is in charge of the UPMC senior communities. I'll explain that in a second. And then Dr. Nace, who is the geriatric medical doctor, head of geriatric services at UPMC, and also the medical doctor charged with the UPMC senior communities. UPMC has 32 senior living residences. Some are nursing home facilities, some are assisted living, and some are independent senior living. They've not had one case as of today of COVID-19 amongst those 32 facilities with the residents living there. They have suggested, let's use a model where you use the academic medical centers across the state, divide the state up into regions, And in each of those regions, one of these academic medical centers, and these are hospitals with teaching, either they have medical schools or they have residency programs, but they're teaching hospitals. And they understand supply chains for personal protection equipment. They have developed their own testing, many of them, because they have virologists or pathologists and other medical experts on staff, also working with engineers, by the way. And they also understand infection control. Health systems, by definition, have to deal with infection control, not just for COVID-19, but for a wide variety of infectious diseases, including flus and hand, foot, and mouth disease, and SIRS, or SARS or MERS that you've had in the past, which are coronaviruses as well, by the way. And we want them to help the nursing facilities, the personal care homes, and the assisted living residents, because they're really not equipped to do it. We want to take some of the dollars that has come from the federal government CARES Act. We have $3.9 billion right now sitting in our funds for the state funds. We want to take $500 million of that and at a minimum, and use that money to pay the academic medical centers to provide really three things: testing and surveillance capacity. The Department of Health is not equipped to do with it. The nursing homes and personal care homes alone are not equipped to do with it. You need the academic medical centers to do the testing and the surveillance. Second, infection control. Go in there, triage the facility, act like a SWAT team, determine what needs to be done in terms of protocol for infection control. And then third, an ongoing clinical presence, at least for the short, long term, putting boots on the ground, nurses, nurse practitioners, in personal protection equipment who can report back through telemedicine to the experts at these academic medical centers. So what we're looking is to work in a collaborative way with who? UPMC, Allegheny Health Network, Penn State Hershey, Geisinger, University of Pennsylvania, Temple University. Those are all our teaching hospitals, and they need to help us get our arms around the crisis in these centers.
And when do you expect this legislation to be introduced in the House?
It moved out of committee today. It moved out of the Appropriations Committee. Myself and many of my colleagues are co-sponsors of the legislation, including two of my very close friends, Democrats, Representative Harry Reed-Shaw, who's one of the Democratic chairs, and Representative Bill Curt, who's one of the Democratic chairs. So it moved out of the Appropriations Committee today.
Now, since you are in Allegheny County, I do want to ask you about the phasing of Allegheny County and 15 other counties from a red phase to a yellow phase,
Yes.
and that's happening on Friday. What are your thoughts on this phasing of opening up Pennsylvania that Governor Wolf has put in place?
Yes, I just don't think that the crayon color schematic is all that telling, to be honest with you. I do think that people in the counties that were not moved from red to yellow were very down, very depressed. 2 months is a significant period of time. And really what people want to do is they want to be able to move to some sense of normalcy given new safe distancing protocols, masks, the distance, gloves if you're depending on the work or the activity that you're doing, certainly continued hygiene. I just don't think that the crayon box approach really says that much. I think the key is what can be done safely needs to be done safely. And that means students have to go back to school, K through 12, by Labor Day, has to happen. Clearly the kids are not the at-risk population. If you are a child that has an underlying medical complexity, which are a very small number, but the school district has to accommodate you. And if that means they have to provide you full cyber charter education, they need to do that. They can do that themselves. They can do it through the IU. They can do it through one of the existing cyber charter schools. In addition, the colleges and universities in the state, they know that they have to open up. They're going to lose students, parents who have saved thousands of dollars for their kids to either go to college, university, trade schools in the Commonwealth of Pennsylvania. They're not going to pay that money again for online learning. They'll find other universities, other colleges, other trade schools in other states. They really need to open up. They should try to open up this summer under prototypes, under certain types of models. I think these kind of activities, just like we did with construction, or what we should do with retail, curbside delivery, small pops and the bigger shops. The large box stores are open, the small mom and pop shops should be open. And because the moms and pops are people that work hard and they know how to mitigate. Florists, bike shops, Hallmark stores, they can do it safely. These small mom and pop shops are the lifeblood of our economy and our communities. And these people work hard. And to take that away from them and their ability to earn a living is just sad. So I'm glad we're moving into quote unquote yellow in Allegheny County on May 15th. But I just think people are going to make their decisions regardless of the color coding.
Now, there have been some counties that have said that they are going to reopen, whether or not the governor says that their county should. What is your response to that and to the consequences that Governor Wolf has laid out for counties that do participate in that?
I think what the governor should have done, instead of calling these folks cowards, I think they are reflecting, the folks, these elected officials in these counties are reflecting what they're hearing on the ground. They're talking to everyday people. We are in our district office, and I know my colleagues are in their district offices. The phone calls are nonstop. They were people with business, not interested in making money. Like this florist in our district takes one vacation a year, takes her granddaughter on vacation, said she had maybe 4 to 6 weeks in savings. Walmart and others are selling flowers, but she couldn't sell flowers. And she said she was already mitigating. She was already taking online payment, delivering to doorsteps without interacting with folks, wearing gloves, wearing a mask, few employees on site. That's so sad. And if you talk to these folks all across Pennsylvania, people are really down. There's higher incidence of domestic violence. Just talk to your local police. There's increased drug addiction and alcoholism. More people are suffering from mental illness. I can assure you, you talk to people in the medical community, people aren't getting health care right now because they're afraid to go into these settings, but they're putting off healthcare, issues not related to COVID-19. Heart attacks are going up, cardiac arrest. Moms and dads who are at home trying to work and raise the kids are really struggling. Particularly, these are people that, they're worried about making mortgage payments and car payments and payments for other aspects of their lives, including, food. I just think the governor's not in touch with these folks. He should talk to those county commissioners. He should talk to those state representatives. He should talk to those state senators. They are talking to everyday people. They're taking the phone calls. They know how sad it is right now. 1.8 million of our fellow citizens have filed for unemployment compensation claims.
Now, one final question for you. How can the governor's administration and the legislature work together to help keep Pennsylvanians safe while maybe also slowly reopening the state and reopening businesses so that people can still enjoy their livelihoods while being safe?
First of all, it's come at a significant cost. 1.8 million Pennsylvanians have filed for unemployment compensation. It is, amongst any of our fellow states, the highest percentage of a workforce. Out of any state, it's 25%. If you looked, it's actually higher than 25%. Illinois is like 13%. Florida is like 18%. Ohio is about like 18%. we've had the strictest and most broadest ban out of any of the states. People are suffering, they're hurting. So where can we find a way to work together? Well, first of all, let's just say the pressure has been taken off the health systems. So that's a success story. To a large extent, there's flattening of the curve. By the governor's own measurements, let's pivot. Let's make the decision to, quote unquote, open up under CDC requirements. Let people get back to normalcy. The COVID is not going away. We see who's vulnerable after 2 months of data. The average age, according to Dr. Yealy, who's a UPMC head of emergency medicine, told me the average age is 84. Last week, Secretary Levine told me the average age of those who have passed away was 79. Dr. Yealy told me yesterday 84. It's clearly beyond the, what the average lifespan of a citizen in the United States is. Let's protect the most vulnerable. Let's get a direct plan for those in these senior living environments. Let's make sure that kids get back to school. Come up with a plan for those that have underlying medical issues. Let's make sure the universities and colleges open. And I think by June 1st, there should be activities for the young people. They should be able to swim. They should be able to play baseball and softball. They should be able to do track and field. We can come up with safe social distancing. Kids have dreams, and people need they live through their children and grandchildren. We have to let those dreams begin to take place and go back into gear. This can all be done safely. We have to learn to live with the COVID. Until there's a vaccine, we know that there's medicine that's available now that the federal government's sending and many facilities are using. We need to get that around. It's not, I'm not a medical expert. It's not a be all or the end all, but Dr. Levine talked to us about it today. We need to get that out and about throughout the state. That's how we have to work together moving forward.
Speaker Mike Turzai, thank you so much for your time.
Cass, thank you for having me.
PCN is committed to providing the people of Pennsylvania with the most up-to-the-minute information about coronavirus, daily special programming with civic, business, and government leaders, and how COVID-19 is affecting the community, airing weekdays at noon and 8 p.m., live special coverage of the governor and the Secretary of Health, as well as programming designed to inform and assist everyone impacted. Go to pcntv.com for the latest information.
I'm here with Curt Shroder. He's the Executive Director of the Pennsylvania Coalition for Civil Justice Reform. Now, Curt, can you tell us a little bit about this organization and what you guys do?
Sure. The Pennsylvania Coalition for Civil Justice Reform is a bill that fights for fairness in the courts and fairness in the legislature. We want to make sure that there's a level, balanced playing field for all litigants, and that one side doesn't get treated more preferentially in the system than the other.
Now, earlier this month, you released a statement in response to an executive order from Governor Wolf. Can you tell us a little bit about that executive order and what it laid out and why you released this statement?
Sure. Just a few days ago, Governor Wolf issued a long-awaited executive order that will provide limited liability protection for some licensed and certificated professionals, doctors, nurses, and others who are working on the front lines of the COVID-19 pandemic. Now, that's a very good thing as far as it goes. The issue is that those doctors and nurses are only protected while working in certain facilities. They're protected from liability while working in a hospital, for example. But the same doctors are not protected from liability when treating a COVID-19 patient in their office or in an outpatient setting. So that's a big problem right there. And also the executive order unlike many that have been enacted across the country, fails to protect the hospitals, the nursing homes, the health systems, and others who, are really on the line and facing increased liability exposure and a threat of increased liability exposure because of this pandemic. And let's not forget, these facilities have never seen this kind of healthcare threat, these kind of working conditions at any time, at least during our lifetimes. So they're really operating under very dire and unique circumstances. And, fortunately, while the governor did take some action, the order that he did issue doesn't provide the full realm of protection that's needed.
So you mentioned that this offers limited liability protection. What is that protection, and how does it differ from a more expansive protection for doctors and for health facilities?
Well, it protects them from what one might call ordinary negligence, and that is certainly something that we are looking for, that the healthcare providers and others are looking for. But like I said, it doesn't go all the way in its protections. It only protects doctors, nurses, and some others if they're working in a specific setting. It doesn't protect them if they're working in their offices or in an outpatient setting treating COVID-19 patients. It provides absolutely no protection to the facilities themselves. And these facilities are, as I said before, they're operating under some very extreme conditions. There's a worldwide shortage of personal protective equipment that they're all dealing with. There are elective surgeries and procedures that have been delayed and are not available at this time, that these facilities have had to push off. And while elective procedure or surgery sounds kind of non-threatening, that can include heart surgery, cancer surgery. It's not all like knee replacement surgery or those type of surgeries where, well, if you just hang on a little longer, it's not necessarily life-threatening. So they face liability for those type of decisions as well. And they also face liability because patients are infecting care workers who are, who could then reinfect other patients. And so, like I said, these are extreme and very unique circumstances that our entire healthcare community is dealing with. And, they're putting themselves out there on the front lines, trying to protect you and me from this COVID pandemic. I just think we owe it to all of our healthcare providers to give them liability protection after this is said and done.
So what was yours and your organization's response to this executive order?
Well, while we, did commend the governor for doing what he did, we have called on the legislature to take action to pick up where the governor's executive order left off. In addition to healthcare, there are companies that are producing personal protective equipment, and they have either retooled their facility to work to produce personal protective equipment, or they've ramped up their production. And either way, the chances of liability exposure increase during those circumstances. So we also believe that PPE, personal protective equipment manufacturers and distributors, should also have this liability protection. And the order didn't address that at all. So we've asked the legislature to please act to protect those who are stepping up to make a difference during this difficult time.
Are there any other actions that you'd like to see the legislature or the governor take in order to protect healthcare workers and those who are on the front lines?
Well, there is. As we're moving now into different phases of Pennsylvania in the reopening of Pennsylvania, it's going to be very important that our businesses have some security when they reopen. One of the big dangers is that someone, could sue a business for saying they received COVID-19 while on their they contracted COVID-19 while on their premises. Well, that's very hard to prove or disprove. And we believe that as Pennsylvania begins to open up, these business owners should have a liability protection as long as they're following CDC guidelines, as long as they're following all the rules and regulations that have been put in place. We believe that they should have protection as well. Because if they don't, it could be a real drag on Pennsylvania's economic recovery. We could see ourselves in a situation where some businesses decide not to open, or maybe open on a very, very diminished capacity because of fears of lawsuits. And we know that the plaintiff's bar has been out there meeting, organizing. You read articles about it all the time, some of the different things that they have planned and are looking, unfortunately, they're looking to, make a fast buck off of this healthcare pandemic once we get past it. I think that's really unfortunate. I think that victimizes everyone, the public, businesses, employers included. And I think our state General Assembly, the Pennsylvania General Assembly, really needs to act to make sure that these protections are put in place for the benefit of all Pennsylvanians.
Now, if these businesses do open at a diminished capacity in order to prevent having these lawsuits brought, what other ways are there for these businesses, for these employers to help protect themselves against these potential lawsuits?
Well, without liability protection put in place, or some sort of safe harbor for following all of the government edicts and directives, we're not suggesting anyone break any rules. I mean, we want to make sure that if they're doing the right thing, if they're following, CDC guidelines, other directives that are out there, perhaps from the Pennsylvania Department of Health, that be in essence a defense to any attempts to find them liable for for some of these things. So we believe that as long as a business is opening in good faith, as long as they are following the procedures and laws and regulations that have been put in place, they deserve protection. Like I said, if we don't, with the unemployment rate that we now have in Pennsylvania, with the economy that is, has been so hurt by this pandemic, that'll only make it that much longer to recover and to resume, some semblance of normalcy in Pennsylvania.
Is there anything that the community at large here in Pennsylvania can do to help protect our healthcare workers, those on the front lines, as well as businesses and employers?
Well, I think certainly, just in general, individuals can, heed the social distancing guidelines. I think that's very important. No one disagrees with, no one, I think who is responsible disagrees with any of that. And so, we urge everyone to continue to, heed the social distancing guidelines, be responsible individuals and citizens. And that benefits not only them, but all their neighbors, co-workers, people out there in the community and in business and healthcare as well. But we also ask everyone across the state to please contact your state representative and your state senator and explain to them that liability protection, giving safe harbor to our healthcare workers who are on the front lines, those that are making personal protective equipment, and the businesses who are about to open up in Pennsylvania, to make sure that they're treated fairly and that they don't just become the victim of the plaintiff's bar in trying to make a fast buck as we move forward out of this pandemic.
Curt Shroder, thank you so much for your time.
Thank you very much.
Join our guests for insights on issues impacting local government and the citizens of Pennsylvania. Created by the Pennsylvania State Association of Boroughs, Inside Pennsylvania Boroughs connects you to legislation and policy that will affect you and your family. Your host, Chris Kapp, and his guests discuss current affairs that matter to you most. Connect with your state by tuning into Inside Pennsylvania Boroughs on Sundays here on PCN.
I'm joined by the president and CEO of Little League International, Steve Keener. And the decision was made, Steve, a few weeks ago, or actually about a week or so ago, by you and the organization to cancel the Little League World Series. Every year for so many years, going all the way back to the end of World War II, people have been flocking to Williamsport, Pennsylvania in late August for the Little League World Series. And obviously it was a very difficult decision for your organization to make. But why was it important for you to make that decision now?
Well, Bob, first of all, thank you for having me. And I think maybe I have to go back a few weeks to sort of put in context how this came to be. When we suspended local Little League seasons based on recommendations from the federal authorities, the CDC, we extended that to a May 11th date for either the resumption or starting of the Little League season. And we knew in that was done 7-8 weeks ago. We knew in that time period then we were going to be having to make a lot of decisions about what are we going to do after that date. And we still don't know what actually is going to happen yet. But over the course of that time, we started seeking input from certainly the senior public health officials, Dr. Levine here in Pennsylvania, who also consulted with the governor for us. And then we reached out to the same senior officials in public health in the other 10 or 11 states where we host regional and other World Series tournaments. We coupled that with talking with some federal officials in the State Department, as well as at the CDC. And what we learned through those discussions was the very complex travel restrictions that are in place, and that if they are relaxed at all by midsummer, even then, because of the shutdowns of our embassies, that it would be very difficult, if not impossible, to get all the visa applications processed in order to bring the international teams to Williamsport and our other 6 locations for our World Series. So sorry to make that such a long answer, but the point is, Bob, that over those 6 or 7 weeks, we were getting all of this information, and it became very apparent to us, critically, for the Little League World Series in Williamsport, based on direction from Secretary Levine, that it was going to be impossible to host the World Series. So we thought it was important to make the decision, get that out publicly, so that when local leagues, whether in Pennsylvania or other states, will know that they have pretty much the rest of the summer or even into the fall, if their local authorities, their state authorities will allow them to resume or start a local Little League season. So our highest priority is always, the millions of kids who are playing in our program that are isolated right now, home from school, confined, disappointed, all those things. We want them to get back out on the playing fields and have some semblance of a season. And if we're lucky, maybe in some states, Pennsylvania, I don't know, obviously depend on when the governor lifts restrictions on groups of over 25 people getting together. Maybe by the end of the summer, they can even pick their all-star teams and have a local district tournament so that those kids who are aging out of our program this year still get the benefit of having had that Little League season and perhaps the all-star tournament experience as well.
Yeah, I think that's a great point, because when people hear that the Little League World Series has been canceled, you're talking about the ultimate end result of Little League season. It doesn't necessarily mean, look, Little League baseball is as American as you can get, and kids have been playing baseball and looking forward to playing baseball this summer all forever and a day. And obviously this generation's Little Leaguers are looking forward to the same. It doesn't necessarily mean that Little League baseball in the state of Pennsylvania and other areas is done for 2020. We can only hope that will change as the governor makes changes in the state of Pennsylvania from yellow to green, that hopefully Little League baseball can possibly still be played at some point in time. It's just ultimately the World Series that right now has been canceled.
Yeah, absolutely right, Bob. And that's what we wanted to make clear last week when we made the announcement that all we were canceling was the World Series and the 82 regional qualifying tournaments. Everything else is still on hold right now, and with some hopefully cautious optimism that can still be played. There may be some states. Now, I know Pennsylvania's already canceled this, but there may be some states where they'll actually be able to play a district tournament and maybe go all the way to a state tournament, which would be terrific if they can accomplish that. But the important point is let's get kids back out on the playing field. That's where the real benefits of the Little League program are found, in thousands of neighborhoods and communities around the country and 83 other countries that are part of our program. That's really what's most important and what we want to get done.
The other aspect of all of this is that for you and for Little League Baseball, Williamsport, Pennsylvania is the home of Little League Baseball and the Little League World Series. And obviously it brings people from all over the world. It's not just the teams from Pennsylvania. Obviously it's teams from all around the country, and it's from teams from all around the world that gather in Williamsport every August for the Little League World Series. And so there's obviously a lot of businesses that benefit from that in Williamsport and all of Lycoming County. And all of them obviously have some serious ramifications of what this means for all of them. I'm sure that also weighs on your mind.
Yeah, that weighed heavily on our thoughts as we approached having to make this announcement. According to our Chamber of Commerce and some economic impact surveys that had been done in recent years, we're talking about a $35 to $40 million economic blow to the greater Williamsport community, and we don't take that lightly. We understand the disappointment and the hurt that's going to cause a lot of businesses and organizations in our area. So obviously we're just as disappointed about having to do that. However, I would tell you that and I've had limited contact with a lot of people in the community for obvious reasons. But for the most part, the people that I've heard from who are businesses and organizations who have been such great supporters of ours for many years, they understand. They knew this decision was inevitable, and they believe it ultimately was the right thing to do. Doesn't make it hurt any less, but it's at least they do understand that. And when in my communications with Secretary Levine over the last couple of weeks, it became very clear that it would be very irresponsible to be bringing 150,000 people from 8 different regions around the world and 8 other regions around the United States to central Pennsylvania with so much uncertainty around the public health concerns that will still be with us in late July and early August. So it was the right decision. I can't underscore enough how helpful Secretary Levine was to us in reaching this decision. It really under her direction that we canceled this, and but she provided us with terrific counsel, data, facts that showed why it would be impossible to do it. So we're very fortunate in this state to have someone like her in that leadership position.
So from your standpoint and for Little League International, it's now you get a little more time to work on it, but now it's all full speed ahead for 2021.
Yeah, I was on a call yesterday with all of our employees late in the afternoon where we were going over some things, and I said to them, it still hasn't quite sunk in that July and August are going to be a lot quieter around here. I said, so the one good news for all of you is that we're lifting the prohibition on July and August vacations. Anyone wants to take some time off that you haven't been able to do in the past, now would be a good year to do it. But we're going to come back in 2021 and hopefully be stronger and better than ever, and try to figure out some ways that we can make this event even more meaningful for the kids who play in it, their parents, the families, communities, and also for the greater Williamsport community.
So for those coaches out there around the state of Pennsylvania who might be watching this, and for parents and for Little League kids as well, if they want information on moving forward for this season, you have a great website. It's littleleague.org. And I know from your standpoint, there's a lot of information out there. If somebody's interested in finding out some more information about what they can do in terms of dealing with the COVID-19 aspect of it, but getting their league started, that's a great place to start.
Yeah, the website has a whole section devoted to the resumption and startup of the 2020 season. I think the actual plan was sent out to every local Little League. I believe it was last Friday, May 1st, whenever that was. But a lot of good information. It tells them everything they need to know from a public health standpoint, to even giving them some ideas about how to organize some activities that will be beneficial for the kids in their program, whether it's baseball or softball. So a lot of good information there. And our offices remain open. I mean, even though we're working remotely, our administrative offices remain open, and they should feel free to call us or email us, and we'll certainly help them to whatever extent we can.
Well, Steve Keenan, there's nothing more pure than Little League Baseball. I know it's difficult for you guys and your organization to have to make this decision. It doesn't come easily, but I wish you the best moving forward. hope for the great things for 2021. I know it was supposed to be a great anniversary season for you guys in 2020. But let's hope for a great 2021.
Thanks for having me, Bob. We're hopeful that 2021 will be memorable. I'm sure it will be the first year back after this hideous pandemic, and we're looking forward to better days. And thanks again for having me on PCN.
Appreciate that very much. President and CEO of Little League International, Steve Keener.